Hello, everyone. If you can hear us, all right, could you raise your hand, please? Or if you're on Facebook, can you give us a like, love? Good to see you guys.
Hey guys.
Yes, we're full house as well today, so a lot of people need to go to Facebook to watch our replay. So if you're watching replay, also hashtag replay, just we know you're watching. So we're going to give you more exciting seminar in the future. So cool. All right, I think today we very honored to invite to the Andy Rosenfarb to join us to give us a bit on topic on eye diseases with treatment of acupuncture and Chinese medicine. Obviously, I heard of Andy in the different Facebook group, and it's been a long time. I try to chat with him and try to learn from him. Even we try to invite him to give us seminars or lectures on this kind of area. I think it's very niche, and I think it's quite important that we are able to help patients not only in just in general, but also we try to see if we can have more of a niche practice mean in Chinese medicine and acupuncture. And like Andy is very successful in this area, is pioneer. So yeah, we try to see if we can pick his brain and learn something from Andy today. So yep, Andy, welcome. And
Thank you.
can you give us a bit of introduction about yourself?
Yeah, so most of you guys know I practice in New Jersey in the United States. I've been practicing since 1997. So what is that, about 23 years? I've developed a specialty practice in Chinese medical ophthalmology that really developed probably over the last 18 to 20 years. It was everybody asked me how did I get into Chinese medical ophthalmology, and so early on I started to get a lot of patients with eye diseases, not a lot, like some, and I went back to my notes and went to Pacific College in San Diego, and this is by no means no dig on them. It was a great school, but at the time there wasn't anything. There was no content really on how to help people with eye diseases like macular degeneration, glaucoma, retinitis pigmentosa, eye strokes, retinal detachment. Certainly nobody was talking about computer eye syndrome, dry eye, stuff like that. So like I had 3 pages, actually not 3 pages, 3 sides of notes from like my entire 4 years, 3.5 years at PCOM. And that's just because there wasn't information on it, and everything in like the Shanghai text and everything I could find just said like, treat everybody for like liver kidney insufficiency, sometimes liver cheese stagnation. That was it. I didn't really understand why. Like as I progressed and learned more about it, I understand a little bit why about it. And those of you guys who've taken my courses or have heard me lecture have got a deeper dive understanding on that. But and then it was like, use all the same points. It was kind of these like gallbladder 20 and some of the local points and, small intestine 6 and LI4 and gallbladder 3. So, and I just wasn't getting the results that I thought I could be getting. And then even when I was in acupuncture school, a lot of my teachers at the time were just like, yeah, don't even bother trying to treat eyes, vision, hearing, and like any degenerative brain kind of conditions like Alzheimer's or Parkinson's. It was just kind of like understood that was like, don't even really bother. They're kind of too difficult. Stick to pain. Fertility wasn't even a big thing back then. Allergies, headaches, most of it was like pain. So that was it. You know what I mean? That was like, so I observed when I had these eye patients that there wasn't much obviously out there in terms of what I could find to help these people, and the results I was getting wasn't great. And I had this belief system in my head that like, hey, if I could help somebody with headaches, and I could help somebody with asthma, and I could help somebody with allergies, and I could help kids who are bedwetting, and people with like anxiety or depression, stuff like that. Like what is it? Like what is it about the body that restricted Chinese medicine from being able to help people with eye diseases? So it just didn't sit easy with me. So I kind of went on a quest. I was like, all right, well, I'm going to figure this out. Either it's going to go one way, either I'm going to prove that there's nothing that could be done, or I'm going to find some stuff out that may help. So this was before I had kids and before I was, back when I was single and I had a lot of time on my hands. So I went out and I did like a lot of research and tried to find, different people. I went to China, I went to Europe to find anybody who was doing anything with eye diseases. So I kind of went around the world and I started emailing people and, just finding whatever I could whatever came to eye diseases. I didn't even care if it was acupuncture, Chinese herbs, or whatever. I was like naturopathy, functional medicine. I don't care, like Bates method, Ai Qigong, any Western supplements, eye exercise, anything. I just wanted to find anything that was available on this so I could have a better understanding and appreciation. So after about 3 or 4 years of doing research and just putting together, I had this thick notebook full of just stuff that I'd get from people, and then it was time to test it. So I was testing all the points that people recommended to me, testing the different systems, testing the different acupuncture techniques and how the needle points and how to, all that stuff. So after taking this big book of content, I kind of stripped it down, and like I'd say like 80% of it was like garbage. It didn't really, in my experience, I just didn't get the results that I thought I might have. And I was like into homeopathy and all kinds of wacky stuff, color therapy and magnets around the eyes, anything I could find that worked or that was supposed to work. So what I was left were a few points and protocols and a few acupuncture systems that I was really starting to see results with. A lot of you guys know one of those systems is the microacupuncture 48 system, which I'll talk about a little bit later.
Yeah.
And certain acupuncture points and electroacupuncture and laser acupuncture. And I particularly found the German auricular system to be really, really beneficial. And I found out quick that a lot of the neurological systems, the brain and scalp acupuncture system, everything that was really getting good results with brain neurological type of stuff like stroke, Parkinson's, Alzheimer's, was also showing to be very useful for eye diseases too. So I really started to gravitate more towards like the neuro acupuncture type of treatment. So, and that was it, just kind of blossomed out of there. I wrote one book and then another book, and I started writing articles, and I started teaching, and then got involved in research studies with Johns Hopkins University here in the States and Nova Southeastern. So those opportunities came up to design research protocols, which were, truth be told, is a little anxiety inducing because, I was like, I got to come up with one size fits all protocols. What if it doesn't work? Nobody's going to come see. There's a lot of anxiety around that too, but fortunately the protocols proved effective. So that was the initial story of how I got into this.
Yeah, I think that is really, eye is not a small thing. It's actually a big thing. So when you think about it, you mentioned about the neuroscience, neurological, which exactly that, that link back to the eye is just part of you need to see the whole forest, not the tree. So I think there's a lot of depth in, if we talk about eye specialization, it's not only treating the eye, it's have that deep understanding of the whole life and whole person, and including the neuroscience, which is, I saw you did a lot of work on the Neuro Summit in the US, and I work with Clayton, and I think that is the whole thing. Like, it's not only that one small thing, but again, the patient, when they come to us, is they talk about, like macular degeneration, they come with this, but our knowledge base has to be so deep to be able to help the patient. It can't be just treating the eye in a few points only, right? Is that right, Andy?
Yeah, it is. And the thing is, a lot of these conditions, conventional medicine doesn't have anything. Like, they really don't understand what's going on. Like, for example, you look at things like retinitis pigmentosa, or some of these genetic conditions like Stargardt's, or Usher syndrome, which is, vision loss and hearing loss. I mean, they're just like, what's the cause? Genetic. We know in Chinese medicine, that just means you have a disposition, but that doesn't mean like, so you have two siblings. Like, we have cases, for example, that are identical twins, means the gene's the same. One person gets this genetic condition, the other one doesn't. So, kind of leaves your head scratching. So with Chinese medicine and things like functional medicine, we have this level of sophistication that conventional biomedicine doesn't have. So when we marry these two together and make it more of an integrative strategy where we're using the diagnostics, the knowledge, and the understanding from conventional biomedicine married to the research and the depth of knowledge and understanding of over 4,000 years of evidence-based empirical understanding of Chinese medicine, it really helps us to understand. So when patients come, they're like, well, my eye doctor doesn't really know too much how to treat this dry macular degeneration. There's no treatment for that. Normal tension glaucoma, there's no treatment. Dry eye, you got eye drops, that's it. So in Chinese medicine, again, we have this level of sophistication where not only we have these branch treatment protocols that we can use using these various acupuncture systems, but we could take a deeper dive and go back to our pulse, look at the tongue, go back to pattern, go back to constitutional diagnosis, and it just, the result of that produces such an incredible outcome for patients, which is really what matters. We're getting results. So we look at the symptom, Scott was talking about, where it's like the eyes, but we're looking at the eyes as it relates to the whole body, the brain, the central nervous system. We're looking at the liver, the kidney, all the 5 elements, from a biomedical, from a Chinese medical, from a functional standpoint. And then we're painting this picture. And, at the end of the day, we're giving patients so much information about their condition and things they can do to help support their condition. And, patients always say, how come my doctor doesn't know about this? It's a good question.
Well, I suppose the specialist is too specialized. That's why they don't know about it. So I think that there is the gap that I think we, as a Chinese medicine practitioner, acupuncturists, can fill that gap, because I don't think they'll improve on that, become more broader and so on. I think they'll go more and more specialized. So the downside of it is there's a big gap between the patient who is suffering and then too specialized. I think we, as a practitioner of Chinese medicine acupuncturists, can really come in to help patients.
I agree. Well said. And that's what it's all about. It's all about clinical outcomes, like helping patients, obviously with any condition, but with vision, it's simple. Try to help them recover vision if we can, and then keep what they got. That's it. And then prevent any other, like somebody comes in with a retinal detachment, there's nothing. The doctors don't even explain to them that they have an eye stroke. They don't explain, like, why do you have that? Why do you have floaters? Why do you have macular degeneration? You're old, or too bad, bad luck,
Yeah.
They don't know, maybe genetics or something like that. But we have this level of understanding that, as you said, Scott, really fills gaps and helps not only us understand, but then we communicate to the patient, and they're like, oh, they understand the role of diet, the role of stress, the need for exercise, all the factors involved, and they can, take power back. They feel like, oh, there's something I can do, and I'm not just like left to chance, and it's a real scary place. So we empower them and we give them things they can do. We provide hope.
Yeah, I think also the guidance and direction for the patient, and also they can be empowered when they can see the improvement. So try to take charge again, not only like waiting the eyesight to go slowly going away. I think it's a very scary feeling. It'll be similar to cancer, let's say for cancer, like if you're losing eyesight, I suppose that feeling of a fear, I think that is very big.
Huge fear. And that's exactly, I actually, it's funny you say that, because I use the analogy all the time as well for these, and, let's face it, most, conventional doctors, not all, it's a lot, the bedside manner isn't so great. So they go, oh yeah, you have macular degeneration, you're going blind. Okay, so what can I do about it? Nothing. Well, nothing.
Nothing.
What do you mean nothing? Like nothing. So.
Yep. With very similar conversation with oncology patient, like you have 3 months, or you have 6 months, or you have, palliative care. So I suppose that is probably similar feeling from oncology kind of side of things as well.
Yeah.
I think we have a lot to offer as a Chinese medicine practitioner, acupuncturist. So we try to see if we can, pick your brain, see if we can learn something, and then hopefully one day we can go to attend your, courses, seminars, so we can, learn more of this, how to help the patient.
Yeah, I mean, guys, look, we got baby boomers, which are the biggest generation on the planet. They're, getting old. Guess what? We got this thing now called computers, and we got these things called cell phones.
The iPhone, yes.
Yeah, they're emitting blue light. You guys can see my glasses, right? There's a little reflection, a blue-purple reflection, because these are blue light protection to keep, but the screens are going to accelerate macular degeneration, the LED lights and everything. I was like, look, I don't really freak out about it, but we have to pay attention to that. You have to educate patients that, we live on these and we live on this. We spend hours and hours and hours a day. So our physiology has not evolved, over the last 20, 25 years that we've been, 20 years maybe, that we've been using screens as much. The body, the eyes haven't developed the protective mechanisms to be able to deal with the amount of light coming in and the flickering and the blue light. And, our ozone layers are starting to decline a little bit. So the UV radiation is coming in. People are getting cataracts real early stage because the UV damages the retina, but really attacks the anterior compartment. Mm-hmm. So you see a lot of anterior inflammatory conditions as well. So a lot of this about, a lot of the teaching that we do is about educating patients on prevention. They don't know that they have to turn their phones onto blue light at night. They don't know to go to the opticals and get, blue light protection for their glasses or take breaks.
Yeah.
But there's a lot of education to be had.
Yes. And are you able to talk about like what Chinese medicine ophthalmology is involved in? Is it talk about herbs and acupuncture? Is there pattern differentiation? What is with Chinese medicine in eye diseases?
Yeah. So obviously we always look at Chinese medicine. Every classical text, we talk about the liver, the eyes are the flower of the liver. It's the sensory orifice, the sensory jing from the liver comes up to the eyes. And then we know from classical Chinese medicine too, we talk about, the brain is part of the kidney system and the spine is part of the kidney system. It's not talked about so much as the eyes being part of the central nervous system. They're one nerve off the brain. So we talk about the central nervous system or that kidney system. It's brain, spinal cord, and eyes, and the optic nerve. So the structural component, at least the neurological part of the eyes, the retina, the optic nerve, and the brain, the whole visual process, that's kidney. So the structural, if there's developmental problems with vision or these genetic conditions, we always look towards kidney, right? Any genetic conditions is Jing deficiency, we say in Chinese medicine. But the function of vision, how the eyes see, the qi part of it, the energetic process of seeing versus the structural part is more a liver process. So the function of vision is liver. The structural components of the nervous system, rods and cones, the optic nerve, the tracks to the brain leading to the visual cortex, the prefrontal cortex, the different lobes that help the brain interpret the visions and process and make sense of what we're seeing. That's all kidney system. So when we see structural breakdown, we're looking at kidney. When we see functional issues where the structure is fine, we look more liver. But then we get more specific. We have what we call the 5-wheel theory, where we have different structures of the eye, like the sclera and the lens and the cornea relate to the metal element. And then we have the choroid and the blood vessels in the eye, of course, relate to the heart. And the inner canthus, or the red parts, and the outer canthus as well relate to the heart element. And of course, the earth element that plays a huge role, especially in cases like macular degeneration, where we see accumulation of dampness. We have what's called drusen, which is buildup of it's mostly fat, a little bit of calcium, but it's mostly like cholesterol. So we have those conditions. So we see these different the 5 elements that again brings this level of sophistication, so we can have a deep level of understanding. Generally, generally say if somebody has a functional issue where the structure is fine, it's going to look more towards liver blood, liver qi stagnation, liver yin deficiency, liver fire, kind of at least start looking in that area. And it could be a cause of effect, right? It could be a functional liver issue that's affecting, it could be rooted in a lung metal disharmony, right? Or it can be large intestine elimination. That's it's like backwashing and affecting the liver. Or you can have a deficiency of kidney and energy that's not feeding the liver. So again, even though it's the eyes, we still have to not get lazy and say, well, yeah, I'm just going to treat the liver. I'm going to do liver 3, liver 8, gallbladder 34, gallbladder 37. We have to check the tongue, check the pulse, and look at the pattern of what's going on so we really understand both root and branch. And that's the beauty of treating vision, is because we're helping people see. So yeah, we want to use our points and use the different protocols and stuff that we know help vision. But what I found is that if we don't go back and value Chinese medicine and look at the patterns, it's just going to go back. You know, so if you don't identify that somebody has like, and again, some people do herbs, some people don't, but if you don't treat the underlying cause, in this case, meaning the pattern, that your results aren't going to really last very long. And then patients are going to get upset because they're going to get like 2 weeks where they see better, and then it's going to go right back again. So that's why I'm coming into this with both the branch treatments, like, you know, the microacupuncture points and the electroacupuncture, while understanding the deeper pathologies, which are going to be unique to different cases, are certainly going to be, you know, important for each individual case.
Yeah. And when you talk about the the acupuncture, like what system is it based on? And like, is acupuncture is a combination of different system, or just one system, or if you're experienced?
The microacupuncture 48?
Yes.
Yeah. So I'll give you guys a quick and dirty on that. The microacupuncture 48, it was a hybrid system. It was developed by a gentleman named Freddie Dahlgren in Denmark in the 80s. And he was trying to treat patients with arthritis. He was a pretty good acupuncturist, and he was really impressed with the long bone theory. I don't know if you guys have ever heard of the Equo system, embryo contain the whole organism. Dr. John created this, and the system was a long bone. You know, a lot of you guys study Master Tong and Mr. Tong. So it was very similar to that. He used basically, you know, the long bone finger here, and then that was the original system. And the microacupuncture system was an evolution of just that long bone, and then they took it to all the organs. All right, so it just wasn't this. I said, okay, well, instead of just treating the large intestine meridian, let's try to treat like the head point on the Sanjiao, because we got Sanjiao meridian pain. So they developed a little more sophistication on that, and then ultimately, Freddie wanted to make it even more easier system, and his finding was that the head and tail points were the most active, and like 70 to 80% of the time, just finding the Ashur points on those systems got really good results. So so while they were treating patients for arthritis, a lot of them were reporting that they're saying, hey, you know, my vision's a little bit better. So they're like, really? Okay. So they got some eye charts and they started checking vision. Lo and behold, people's vision got better. So they started creating some protocols and some systems, and they literally put everybody, they had a barn where they were treating everybody, and Freddie couldn't handle. This is a story from Per and Freddie, and they just couldn't handle the overload. So Freddie grabbed one of his friends who is a peat moss farmer, didn't know acupuncture. At the time in Denmark, there weren't any like real restrictions or regulations on acupuncture. And he was like, look, I'm going to show you how to put these needles in. Very similar to like what a NADA protocol technician would be, where you just kind of learn the NADA protocol. You don't really need, you just kind of learn the points and stuff. So it was the same idea as that. He taught Per Ott, which was my teacher originally, this protocol that they were using for mostly treating macular degeneration. So then Per learned that and came to America. And I think it was like 87 or 88. He moved to Texas and started treating people with microacupuncture for eye conditions. He got really big. He got busy, moved to Arkansas. That's when I went down and trained with him in that system. And at the time, it was just one protocol. It was like everybody got the same protocol, and it was like 95% of the practice was macular degeneration. So I started seeing more patients with more difficult conditions, eye strokes, end-stage glaucoma, retinitis pigmentosa, again, eye strokes, a lot of retinal bleeding. So like the protocol was good, but it wasn't working as well as I'd like to. So I went back to learn to my Chinese medicine. And I'm like, all right, well, let me go back and to this protocol, let me learn the system and really start understanding the microacupuncture system. And for about 15 years, I just started playing with the points to figure out what they did. Because it was basically the analogy I give people. It's like, say you have the whole map of the ear, but all you know is the NADA protocol. Like you could spend your life trying to figure out what all the extra points do. And it's mapped for you, but it's trial and error to see what works empirically and according to the map. So that's pretty much what I spent 15 years doing. And that's when I developed called the microacupuncture 48 system, which is the same map, but it's more an explanation of the points. And it's the system. It's a presentation of the system versus just a protocol. So that was the evolution of that.
Yeah, if it's obviously need a system, not a protocol, you're never going to, the patient never gets sick according to the protocol, the textbook, right?
That's right. So, and it gets better results. I found that, like, giving everybody the same thing as most people would imagine, you're going to get some good results. But when we really figured out how to dial in the exact points that each patient needed, like we really found out, it was like we were seeing the results went through the roof. And then we also saw that the results were holding a lot better too. And then we put Chinese herbs on top of it. And we found more about nutrition, and I did some, functional medicine, naturopathic medicine. So we added some elements of that to really just help root the treatment and just get the best results possible for patients.
Yeah. Okay. And what is the most common eye condition that you treated in the clinic? Can you share a bit on that?
Probably about 3 or 4. I see a lot of macular degeneration, a lot of glaucoma. I see a lot of retinitis pigmentosa, and in that family, like Stargardt's, Usher's syndrome, a lot of dry eye patients, a lot more eye strokes. I wasn't seeing that at all probably until about 10 years ago. Over the last 10 years, I've seen so many cases of eye stroke. Dry eye, I see a lot of now, and it's the easiest thing to treat. Like in Chinese medicine, you could have like a whole practice on dry eye, because the conventional optometrists, they hate treating it, and all they have is like Restasis, which is like $4,000 a month anyway for those eye drops, and they just don't work. Why? Because we know what causes dry eye. We can look at the qi blood and fluids, liver blood deficiency, lung yin deficiency, heat, stagnation. We can really source it. Menopause is causing it. And we just dial it in, and bam, like we get such good results. Again, it's this root branch treatment, but we get dialed into the internal conditions of the underlying patterns. And that's why people get such good results. So again, it's really like I do a lot more of the neurological conditions, optic nerve, retina, stuff like that, brain stuff. I don't do too much with like the myopias, like the presbyopia, myopia. I do a little bit of that. Most of my patients do report like their vision gets a lot better in terms of clarity and stuff. But more what we call as refractive issues. I don't spend too much. I do a lot more of the neurological stuff. That's kind of my passion, my expertise.
And with the dry, what do you think is a more dry eyes like become more and more in the society with the dry eye, and the kids as well with the children? Yeah.
They're on screens.
Homeschool.
Yeah, we're like this. You're on computers. You're like, you don't blink. Most people don't blink when they're on screens, and the EMFs and the lights coming off, and we don't breathe. People go like, so our posture and our health when we're on computers, that's one factor. There's a lot, there's a lot of factors. There's just screens, there's air condition, there's forced hot air, heat,
diet.
It's common. There's dry eye is like, it's almost like an epidemic. And like, if you guys market to that, like it's so easy to treat, and people just love, because they're suffering. I mean, if any of you guys know anybody who's got dry eyes, it is so uncomfortable. These people are like, they're in so much pain. And if you just give them a literal relief, I mean, I had a patient who came in from Canada late last year, who literally for 2.5 years was putting eye drops in like twice every minute. Like maybe she said she'd go 2 minutes. That was like a long time for her. After one treatment, it was like she was putting them in every like 5 to 6 hours. So you get like fast results with this. It's great work. It just helps people who are really suffering like that.
Yep. In Chinese medicine, pattern differentiation or diagnosis with dry eye, is it most, I know everyone is different, but is a common pattern that you see with Chinese medicine?
Yeah, liver blood deficiency, but I see a lot of kidney and lung fluids deficiency. Okay. Younger kids, just heat, a little bit like stomach heat and liver heat. So sometimes lung yin deficiency, because the lung mists, the orifices. So not as many people smoke. cigarettes as much anymore. Anyway, in the States, there's a lot of vaping. So a lot of the teenagers doing like the vaping cigarettes, which also dries the lungs out a little bit. So computer use, but the most common thing I see for girls and women's a little bit more liver blood deficiency. With guys, a little bit more kidney fluids deficiency and kidney lung fluids deficiency. So the kidneys are deficient and it doesn't have the fluids in the body's, the energy drinks. I mean, people are drinking a lot of coffee and, a lot of stimulants. So the stimulants cause dehydration and deplete the body's kidneys. A lot of sugar, a lot of stimulants. So there's less fluids and we're dehydrated from all the sugar in the drinks and stuff like that. The lungs can't miss the fluids, so the eyes get dry.
Yep. And do you use a combination with micro for the acupuncture as well with treating?
Yeah, I do that. That local, because just one of the points that I like to use for dry eye is you just look at the structure. Like basically the lacrimal glands are here, so we kind of like put some needles in around here, and then you thread them to up around here where the tear ducts drain, and we stim those points. Sometimes we stim them, sometimes we don't, and then we do the other body points based on the pattern. You can even release the neck sometimes because a lot of neck tension getting the fluid up, and watch the lymphatics around there.
Yeah.
But those are good local treatments. A lot of times too with dry eye, people are stuck in sympathetic stress. So when you're stressed out, we know the body goes to sympathetic. When we get dry eye, dry mouth sometimes when our adrenaline's pumping. So the other thing we can get is dry eye. So if you ask somebody to have dry mouth and dry eye and when they pee, it's kind of more yellow and not so clear. So you tell them, take electrolytes, magnesium, potassium, little sodium, stuff like that. Drink more water, watch electrolyte or watch caffeine, watch energy drinks, watch sugar, just hydrate and it's less alcohol, stuff like that. Beer's okay.
Beer is all right. Yeah, only beer, but only the cold beer, isn't it?
Yeah, right. Yeah.
The cold beer.
That's right.
And and are you able to talk about the macular degeneration? There's a dry type and wet type. We want to know a little bit more. I think a lot of people ask me to ask you about the macular degeneration. Why is it different? And in Chinese medicine, Western medicine.
Yeah. So macular degeneration, we have wet type and dry type. Dry type, all that means is we have what's, again, the cholesterol that's building up in the Bruch's membrane, which is kind of basically between the retina and the nerve layer. So what happens is we have this buildup of ocular waste products. It's very similar to heart disease, right? The way when I lecture to doctors, I explain to them that it's a different branch of cardiovascular disease. Actually, there's 3 branches that we know. One goes, we have cholesterol builds up around the heart and the arteries, it clogs it. It also goes to the eyes. So people with macular degeneration, they're also risk of heart disease. What else do they risk at? Where else do we have, plaque buildup in the body? The brain, we get Alzheimer's. So all 3 of those conditions, Alzheimer's, heart disease, congestive heart disease with cholesterol building up and macular degeneration, they're all 3 branches of the same tree. So we see people who have heart disease, they're at higher risk for macular degeneration, maybe possibly Alzheimer's too. People with macular degeneration, we talk to them about, hey, you don't want to scare people. Say, look, you ask them about their family history. I would say 80% of my patients with macular degeneration have or have a family history of heart disease, cardiovascular disease. So we talk to them about heart-healthy diet. That's the premise. The premise is like, look, this is a cardiovascular disease or ocular vascular disease where your body you have this dampness, we call in Chinese medicine, which is a combination of phlegm and fat pretty much. So it's a liver gallbladder thing too. The body's not breaking the fats down, but it's also the pancreas, not breaking down the sugars because the sugars turn into fat. So people eat too much sugar, that's going to create more fat. It's going to increase more drusen buildup. Or if they have maybe their gallbladder taken out, they're more susceptible to macular degeneration because the bile isn't there to break down the fats, and there's going to be more fats floating around in the blood, which you'll see elevated cholesterol, your LDL, HDL ratios are off. Triglycerides may increase. So you'll start to see this, and they don't have to be heavy. You know what I mean? They could be lean, but the blood level, oh, well, they're thin, so they're not damp. Not necessarily. It just means the liver and gallbladder is not really working too well to break down the fat. So it's kind of floating around their body. They're just not necessarily storing it. So like that's a premise. That's like a baseline that we look at. But then we start looking at it from Chinese medical standpoint. You know, we talk a lot about, again, you know, dampness being caused by the spleen, pancreas, but we also have to look to the liver gallbladder, because we know from more biomedicine, functional medicine, that the liver, the gallbladder produces bile. You know, liver and gallbladder produce bile, and that's what breaks down fat. And cholesterol and drusen is a fat-soluble waste product. So that's why we looked, when we treat it, we look to formulas like Wendon Tong, Urchin Tong. We look at these two formulas that really address the, you know, the spleen, pancreas. The guys who study herbs, we use things in like functional medicine or nutrition. We use things like ox bile, or we could use like Tudka, these types of things that help thin the bile a little bit so the body can start breaking down the nutrients. In Chinese medicine, so again, we're going to look towards those things. We also want to look at the vasculature. So often I'll use formulas like Gui Piwan, which really address the heart and the spleen, pancreas, right? Because if you see somebody who's damp, the heart for the blood vessels around the eyes, if the pattern fits, that's something we want to look at. Certainly digestive enzymes, we want to look at that. Help people with their diet. We pull in our TCM diet recommendations. Cold fatty foods, you know, greasy stuff like that, fried foods, we want to get that out of the diet. Red meat, more greens, because they're good for the liver, but they also break down fats, right? We know the leafy green vegetables and things like green tea and everything that helps the liver also aids in fat metabolism. So, you know, these things are important as well.
Yep.
Wet macular degeneration, Scott, you were asking about that. Is so what happens with wet macular degeneration, I'm going to try to make this quick. This could be like a really long conversation. But what happens is there's so much obstruction that, so let me back up for a minute. So the first thing you guys need to know is that the retina is the highest oxygen consuming tissue in the whole body. No part of the body uses more oxygen than the retina. All right. Before I knew that statistic, I always thought it was the brain or the heart or something like that. So there's a lot of qi activity. The retina is very, very sensitive, needs a lot of qi. So what happens is when you get the blockage from drusen, you don't get blood flow. Same way that the heart doesn't get blood supply, and eventually you get a heart attack, you need a bypass or something like that. Or you need a stent put in. You can't do that around the eyes yet. Maybe they will at some point. So what happens is the blood grows new blood vessels to try to feed the retina the oxygen and the nutrients that it needs. Those new blood vessels are weak. So it's almost like the main lines are like PVC piping. The new ones are like rusted, you know, crappy, shoddy piping job that breaks real easily. So all you need is, like with this new blood vessels, that it's called neovascularization or angiogenesis, which is new blood vessel that also in fact can happen around the heart. There's research showing that happens around the heart as well. These blood vessels are very weak. So you catch a cold, you get allergies, you drink too much alcohol, or you get angry, or, you know, your yang's rising too much, you're going to pop the blood vessel, you're going to bleed. So that's when they start doing injections and stuff like that, and starting to deal with the wet macular degeneration. Now, the misleading part for your patients is they think that if they're getting injections, that it's helping their macular degeneration. Wrong. It's controlling the bleeding and the angiogenesis. It is not doing anything for the macular degeneration. So you tell them, you say, look, you're going to get the injections. That's fine. It's going to work on the bleeding. If you know, you got to let their doctor do that. But on our end, it's like, hey, I'm working on the health, function, integrity of your macula. So, you know, if your doctor wants to work on the injections, like, let him do that. But I need to focus on, you know, making sure. And guess what, guys? If you open the blood vessels and get the blood flow going with acupuncture, guess what? Those blood vessels are going to start to break up, and the body's going to get rid of them because you don't need them anymore. Because they're needed as necessity because the main pipes were clogged or broken. So if you restore the integrity and the blood flow of the qi and blood to the retina with the main blood vessels, you unclog them, the body will actually start to break down and get rid of the wet macular degeneration. Yep. So that's my quick.
Yep. Quick and dirty.
Yeah.
Obviously, there's a lot to cover. Like, you know, if this is a big topic, but I think with the limited time, I think we just cover, like, you know, just as long as we can get something out of it. And we mentioned we're going to have some. Do you have any case study with retinitis pigmentosa, like this kind of condition? And any case study on that?
Oh yeah, that's the most common I see. So I would say that's probably 30 to 40% of my practice, retinitis pigmentosa right now. It's genetic night blindness, for you guys don't know. What happens is from an early age, usually kids will start, the first thing they see is they think the kids are clumsy because they don't have lower peripheral vision, so they start bumping into everything. Or the kids have what seems like night terrors, because at night when the parents turn the lights out, usually you can see shadows. These kids can't see anything. It's like black. So they freak out because they can't see anything. And the parents like, why is kid so afraid of the dark? You know, like screaming. So that married to clumsiness. And if you see, you know, the kids start to like bump into things or anything, it could mean their peripheral vision starting to go, especially the lower, start tripping over things. So also their night vision isn't good. So what happens is their night vision starts to go, they start to develop what's called tunnel vision, right? They can't see out here, they can only see what's in front, and their adaptation is compromised. So like when we go from outside to inside, say you're walking into a mall or a store or something like that, and our eyes adjust really quick, with people with retinitis pigmentosa, their eyes don't adjust. It can take them like half hour, even an hour, 2 hours sometimes. So they walk in from outside to inside, they can't see jack for a while. Like they can't see at all. So it's really difficult for them. So that's why a lot of them wear very dark glasses most of the time, because that helps with the transition. So with acupuncture, what we do, the most common pattern that I found, which comes from actually traditional Japanese acupuncture, TJM, is a pattern called lung deficient with liver blood stagnation. And we see that because if you look at pictures of RP patients, you could see the staining, the pigmentation, and it's crystal clear that's blood stasis. I don't have a slide to show you guys, but if you guys look up, if you Google retinitis pigmentosa and a fundus picture of the back of the eye, you'll see the blood stasis. It's like right there. It's red, purple, blackish stained. So we have blood stasis. And why the lung deficiency? Like, where'd that come from? So again, those of you guys took my class guesses, but I'll give you guys the dirty on that one too. So the majority of retinitis pigmentosa cases, in my experience, this is not even in the ophthalmic world's rate. They have no clue about this yet. It's an autoimmune condition, right? So how 3,000 to 4,000 years ago, the Chinese, Japanese scholars knew this, Korean scholars, whoever figured this out, knew that it was autoimmune. They knew it because there's literature that shows back that it's, for a lot of these eye conditions, it's liver blood stasis, lung deficient. Now, when I was in acupuncture school, lung deficiency always meant weakened immune system, catch colds easily, allergies. But later on, I learned that it also means hyperactive. So we could have overactive or underactive immune system. Overactive immune system is what? Autoimmune condition. So it's, and we can't prove it yet, but we'll testing, we'll get there at some point, because you have to test for retinal antibodies. And the only way to get that is to do a biopsy or a spinal tap. And I can guarantee people are not lining up for that one. So we kind of have to go by like observation. And FYI, some underground research that when I was doing research with these people we were doing with Johns Hopkins University, we were uncovering that approximately 70% of retinitis pigmentosa cases have a family history of autoimmune conditions somewhere in the family. So that's where the lung deficient comes from. So it's not it's just we got to regulate the immune system, because I believe in most cases, the immune system is attacking the retina and breaking it down. So, which is kind of like a liver fire, liver qi stagnation, you know what I mean? So again, if we treat the pattern with RP in most cases, and the main points I use for that is kidney 7, kidney 10, liver 8, heart 8, and lung 10. All right, and then we use some local points, but those are the main points to really, and you could throw in like liver 3 and whatever points you use to help move the liver blood as well. But that's the main strategy that I will use from like a TCM, TJM standpoint to deal with that. You get really, really good results. That's why we use formulas like Shui Fuji Yutang, or we use like a lot of Danshen with these kind of patients, or even if it's really advanced cases, we'll get in there and use like D-Long, not in tea formula. It's really nasty. We'll have them take pills, but that has lumbrokinase in it, which you know is an enzyme that breaks, it's an enzyme and it starts to break it down. I am not sure if it crosses the blood-retinal barrier. You know, across the blood-brain barrier. We don't know if it crosses the blood-retinal barrier.
Mm-hmm.
So these are some of the herbs that we use and strategies that we use, just like from the hip.
Perfect. You cover everything. It's good.
Yeah,
You're a professional.
Yeah.
I think, and I think we almost know it. I think we can take some questions from people.
Yeah. We can jump into some questions. I saw a couple on the dry eyes. So people were asking about like diet. And so some of the points went over dry eyes. Again, dry eye depends. Is it heat or more lung deficiency or yin deficiency? I would generally go for like kidney 6, kidney 10, you know, your yin nourishing points, sometimes liver 8. I'll go to like lung 5, lung 10. I like Sanjiao 3 for pretty much all eye points. Like I use Sanjiao 3 all the time for pretty much all eye points. Liver 2, I use pretty much for all eye conditions. Gallbladder 37, I use pretty much for all those. I also use local points. The main points that I use locally, I use like UB2, Yao, gallbladder 1 here, stomach 2. I'm not too big on stomach 1 because it bruises like crazy. Chiho, I'll use quite often. Yeah, I use that pretty often. UB1, I only will tend to use for optic nerve issues, or if it's like a real like optic nerve that I need to get in like an eye stroke or something like that. It's just, you know, it's right, the needle goes in right next adjacent to the optic nerve. So yeah. I'll use that more when I'm really trying, if there's an optic nerve atrophy case or an eye stroke or something like that, that I really want to get, you know, quick burst of yang qi to the eye. But I don't use it all the time, just very specific cases.
Okay, we'll try to look at some of the questions. Simon, he asked about glaucoma.
Yeah.
Any advice on that?
Oh yeah, treat glaucoma very well, thank you. That's how we treat glaucoma. Just kidding. So glaucoma, again, so you have like normal tension glaucoma. Most of you guys are gonna see what's called primary open angle glaucoma. It's designated POAG. So you're gonna see that in the eye doctor's notes. Here's it really quick, guys. With glaucoma, it's very similar to the other eye conditions we were talking about. The only thing conventional biomedicine has for glaucoma is eye drops and surgery. All they focus on is the pressure. There are a lot more factors beyond eye pressure that cause progressive vision loss of the optic nerve, which is what glaucoma is, with cases of glaucoma. So we tell the patients, let your doctor deal with the eye pressure. They're going to be doing a trabeculectomy, or they're going to do eye drops to lower the pressure. That's fine. We're going to focus on the integrity and health of the optic nerve, which the doctors are not focusing on. So we'll do our points. We use the microacupuncture, we use local acupuncture. Whatever we're going to do, we're going to really focus our treatment on it, keeping the blood flow to the optic nerve while reducing the inflammation, reducing the oxidative stress, keeping the damp off. It's more of a glaucoma is a fluid stagnation, but really driven by liver qi stagnation. And why that is because the liver qi in the liver's job is opening and closing, right? That's what the liver, that part of the liver function is, all opening and closing in the body. So what happens is the drainage system of the eye is obstructed in glaucoma, so we have a lot of opening. Even though it's fluid, people think it's too much fluid. It's more of a regulatory. So we know liver is about regulation of qi. So that's what we need to regulate this a little bit more. So in a lot of cases, we'll use like a Xiaoyou-san or a modified like Danzhi Xiaoyou-san if there's heat and stuff like that. A lot of gallbladder points, a lot of releasing the traps, cupping. Guys, you could bring down eye pressure just doing cupping and trigger points on the neck and shoulders, because so many people hold this here and you don't get the lymphatic drainage. So that coupled with this here, you want to bring the energy down. But the key takeaway for you guys with this is let the eye doctors deal with the pressure. You focus on the optic nerve. You have to do both because the eye doctors are not doing anything for the eye pressure, and the glaucoma patients are under false hope that their vision's going to stay because they're just taking eye drops. So, and last thing I want to say about glaucoma, it is hands down the biggest surgery. So glaucoma specialists do more surgery and more procedures than any other eye condition. So in my opinion, glaucoma patients are very, very overtreated when it comes to surgery and medication. I mean, some of these people are on like 6 to 8 eye drops. So they're over medicated with their eye drops, and there's too many procedures. And there's a lot of scar tissue as a result of that.
Yep.
So
Okay, cool. Thank you for that. And
yeah.
actually, I have a question from Ben. He asked me, like, with recurrent corneal erosion syndrome, he
Yeah.
has it himself for 8 months now. So the eyelid is stick to the cornea, and there's a hole in it. So he wanted to ask, like, do you have any wisdom to share on that?
Yeah, the first thing I would do if he's having an eyelid stick to the cornea because of the erosion, I would definitely put him on something like the LipoVision formula we have, which is like oil-based, because there's no oil. So tears are made out of oil, water, and mucus, and it's just sticky. So for the corneal erosion, you definitely want to get some fat, some yin in there internally, right? Because basically it's yin deficiency with or without heat. Right? I don't know the case. You definitely have your liver, yin, and blood deficiency. You may or may not have heat. Most of the time there is heat in there. So internally, you want to address the jin and yue, the thick fluids and the thin fluids. So water with more electrolytes, do more things to hydrate the body. And then you want to do like, liver blood formulas, but you also want to add like fish oils or flax oil or coconut oil, something to build up that yin, that lubricant in the body. Systemically, if their eyes are too dry when they can't even put the drops in their eye to help lubricate, just have them take a little like sesame oil or castor oil or coconut oil and just like put it on their eyelids. It'll seep inside. And then at the point, it'll get lubricated enough to where they may even be able to use like oil-based eye drops. But I see that a lot. And that's really a fluids. It's a Jin-Yue type of fluid thing, thick and thin fluids. So we have to deal with the water fluids and the oil fluids of the body.
Fantastic. Very good insight. Like,
yeah.
How about floater? Did someone ask about floater?
So floaters can be a lot of things, There's a lot of things that could cause floaters. So I really urge you guys to look at your TCM diagnosis for that. It's not always liver blood. That's like they say it is, but it's not. You can have pretty much every pattern imaginable can cause floaters. The one thing that we do use in all cases is a nutrient called hyaluronic acid, right? It's traditionally used for joints. It increases the fluids in the synovial fluid to lubricate the joints a little bit. It'll also help moisturize the eyes because a lot of times floaters, it's almost like dry skin. So the skin kind of flakes off if you have dry skin. That's the same thing as floaters are. It's little pieces of dead skin that dry off. So it could be the inside of the eye is just too dry, too inflamed. So we add hyaluronic acid, we add some oils to it, we check for inflammation, we get to our base understanding of our TCM diagnosis. But with floaters, use hyaluronic acid, increase the hydration, again, thick and thin fluids, Jin-Yue, electrolytes, water, a formula that's going to address the yin and the fluids and stuff like that. That'll help.
Yep. Thanks for that. And Diana, she asked about short-sightedness.
So myopia. So eye exercise, very good for that. There's a Chinese protocol that I learned when I was in China with a hospital. I'll give you guys real quick. So you basically thread stomach 2 to stomach 1, Sanjiao 23, thread down to gallbladder 1, and then you thread stomach 2 up to stomach 1. And they did a lot of research on that protocol. Very useful. Also got to release the neck muscles, all right? Because even when we get like astigmatism and stuff like that, it's a lot of eye strain. So eye exercise, the eye Qigong exercise, I just did a whole video series on eye Qigong exercises. Very, very important for that. Can really help, really make a big difference with that.
Yep. Stephen, he asked about PXE suggestion. What is PXE, Stephen?
PXE, yeah. There's so PXE is, again, that's a pretty typical inflammation with fluids deficiency with PXE. I've probably had about a half a dozen cases of that. I don't see that too common, too often with patients, but I've had maybe 6 to 8 cases with that. Always heat. It's a fluids deficiency. Sometimes thick fluids, but most often it's a kidney fluids deficiency with some heat driving that. So if you look like some of your, it's a menopause formula, Liu Di Huangwan, that's used more for menopause. I can't remember, I'm spacing on the formula, but it's a Liu Di Huangwan formula. Sorry, I'm mispronouncing it. It's the one where you have heat that's often used for menopause. It's got like, I think like some of the heat controlling herbs, but I use that formula a lot for that.
Yeah. Okay, thank you, Andy.
Treatment length, usually a half hour. For kids, we have an AccuVision Junior program, 15, 20 minutes for most of my patients. So I'm treating patients usually daily, most of my, for the neurological conditions. Dry eye and myopia, these other conditions, you can get away with like twice a week, no less than twice a week. I tell my patients they can't do twice a week, come back when you can do twice a week. But most of my neurological conditions, I do. So this is really important too, guys, before we finish up. Yes, Jerpai Dihuangwan, thank you so much. So make sure if you're treating any patient with a neurological condition, please, 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 please make sure you get their vision tested or in-house or out-of-house before you start. You have to get a baseline. You don't have to. It's my high recommendation. You can do whatever you want. Then after a series or two, series meaning like 10 or 20 treatments, then retest it. Why? You want to make sure your treatment's working, that they're getting a result. And look, you're going to probably have about 15% of cases that are non-responders. You don't want to drag people along. Some people just aren't going to respond. Like if they don't respond, they don't respond. You know, you could talk to them about vision preservation, but you're not going to get vision recovery. So testing before and after with these neurological vision loss conditions, so important. Refer to their eye doctor, have them do the testing. And then, or if you do some like vision testing in the office, like an eye chart, you can do that as well.
Yeah, it's very useful. Definitely is important.
Yeah.
Francis, you asked, was a close angle glaucoma treatment? Is it
Yes.
same? Yeah.
No, close angle is an emergency. So we won't see that in clinic. If I saw 2 cases of close angle, and here's how I knew it. One of my patients, she was an autoimmune patient. She was face down. I had her go face down, and she just, I'm sorry. So she usually went face down. She had a really bad headache this time. She's like, oh, my face hurts a little. I thought she had allergies. So she was sitting up talking to me. All of a sudden, she laid down like this on the treatment table. And she's like, oh! And I was like, whoa. She sat up. She's like, nah, that's weird. It doesn't hurt. I was like, do me a favor, lay back again. She lay, oh! Her head's hurt. I was like, go to the hospital. So as soon as she laid back, it increased the pressure. So she had such high, she went to the hospital, she had like her eye, so normal eye pressure is like 20 or less. Most people have like 13, 14. She had like a 60 some odd eye pressure. So one of the eyes, they had to do an iridotomy to actually release the pressure. But generally speaking, don't treat acute angle closure. Like that's an emergency situation. The eye pressure is too high. They can go blind. There is some information in the texts about it, but that's an emergency situation. If you suspect that or you know it, out, refer out. That's an emergency situation. Eye pressure is too high, could 40s, 50s, 60s or higher. It's going to squash like a boa constrictor, squeeze the head of the optic nerve. Never going to get vision back. So don't even mess around with that.
Yeah. He asked about the eye stroke. We haven't talked about eye stroke a lot. Is related to high blood pressure, or how did you get them controlled?
It's the stroke like anything else. You want to know what most cases I've seen of eye strokes? Guys in their 40s and 50s who go to Las Vegas or down in Atlantic City, drinking too much, doing a little cocaine, brings the yang up. You know, their blood vessels aren't as flexible as they might have been in their youth. Pop eye stroke. See it all the time. Guys go away for the weekend, boys' weekend, they're partying, drinking up all night, smoking cigars. That's most of the time that I see it. Very common. I treat with acupuncture, herbs, and hyperbaric oxygen. If any of you guys have anybody who does hyperbaric oxygen, you're treating eye stroke, it's like regular brain stroke. Eye stroke is one of the few conditions that are time sensitive. So you got to get them in as fast as possible. You want to have them do herbs, hyperbaric oxygen. Again, any of the stroke formulas. You know, any of those formulas. Again, lumbricus, blood movers, very, very important. Because again, why we talked earlier, the retina is the highest oxygen-consuming tissue of the body. Like brain, once those nerve cells die, just like in stroke, that's it. No mas, they're gone.
So do you recommend a lot of patients to do hyperbaric oxygen, like therapy?
Yeah, we just got one today actually for my clinic.
Oh, yeah? Okay.
We actually, I'm seeing so many more patients with eye stroke. We're also using it for post sequela for COVID. So a lot of patients are having ME, chronic fatigue syndrome after COVID, a lot of neurological signs. Hyperbaric oxygen is the best treatment for people who are recovering from COVID. So
Do you have that in your clinic?
Acupuncture. Yeah, it's kind of like a side note. But that's one of the other reasons I got it, because there's a lot of COVID patients. New Jersey is a really high area. So we've been working with some COVID patients who are in recovery. Like they don't have it anymore. They're just dealing with neurological or their immune system's exhausted from the cytokine storm. So yeah, but back to the eye stuff, definitely beneficial for a lot of the eye conditions.
Do you recommend to have that machine in the clinic?
Yeah, if you have 25 grand to drop.
Oh, is it 25 grand, is it?
Yeah, the cheaper, I got a soft one, a starter unit. The more expensive ones in the United States are about 100,000. I got one of the softer ones, the soft beds to start. So they're about 25 grand. But yeah, if not, I would partner up, just have one. Anybody who has brain stroke, eye stroke, non-healing wounds, anything like that, having a connection to hyperbaric oxygen, it compresses oxygen, which we know helps the mitochondria and helps with chi production in the body.
Yeah.
So it's,
Thanks. Oh, good. I think no more question. I think we're to wrap up now. Thanks, Andy, for your expertise and knowledge. We really enjoyed it.
Yeah, really appreciate you having me. It's a lot of fun. We'll do a couple more maybe.
Yes, definitely. I think for me, it's like I asked you a few times. We try to learn it more systematically, like learn the whole like a system, and then I think it's really a good niche. Like I say, it's a small, but I think it's a next big things. With all of us got to Zoom, the kids they're growing up, looking at Zoom, homeschool. I think there'll be a lot of attention deficit, all the eye related. So I think it's a very broad area. So yeah, really excited.
Yeah.
So. All right, thank you guys. Thanks for joining us today.
Thanks, guys. Hey, if you guys have any questions, you can, email me, or we do have books on Amazon. We have online courses. We have all kinds of stuff. So we do have our Microacupuncture 48 Facebook group. And if you guys want to jump on that, if you can ask questions there. That's probably the best place to post questions if you have.
Yep.
If you tag me inside Scott's group as well, just tag me and I'll answer questions there as well for you guys.
Yeah. Okay. Thank you, guys. Have a good day.
Awesome.
Thanks.
Take care, guys. Enjoy your day.